and access to quality, affordable care. And we will make sure that that continues to occur in addition to raising the minimum wage for our city employees, in which we have done. So with that, that is under our authority, and we will continue to work with not only activists, but state leaders to ensure that we get where our people really want us to go. And that is health care for all, because they do matter. I recognize that in every way. But I appreciate you being here this afternoon relative to what we now know is a presumptive case, positive, for the city of New Orleans relative to the COVID-19. I had a call with our governor right around 12:45 p.m., right at the time where the state was issuing their press release. The city of New Orleans therefore moved very quickly to issue ours as well, after having that conversation with Governor John Bell Edwards. What we also know is that positive or presumptive positive is now being tested by the CDC in Atlanta, and we do anticipate results within the next couple of hours. Once that is made, or once the results have been made, we will absolutely make you aware of the results at that particular time. However, our community, as it relates to our hospital community, is moving forward as if it is officially positive, making sure that they're taking the proper steps of tracing that will be necessary. What we also know is that the individual had no association with travel at all. So this is the only case of the illness in the state of Louisiana at this time. My administration absolutely is leaning forward on this and is prepared for the moment. As we demonstrated on Friday, having a tabletop exercise with multiple scenarios, in which this one it really is aligned. Our public safety team and public health leaders are working collaboratively, as we have been over the past several weeks, and of course doubling down with the one case of illness that we know of. This includes leaders throughout the state. On the federal level, of course, the state Department of Health with the governor's office. The Louisiana Department of Health is leading the state, its efforts in the response to COVID-19. And at this time, we continue to believe that the risk to the public remains low. We do know that we have the St. Patrick's Day coming to the city of New Orleans, in which we have a huge St. Patty's Day parade. At this time, I'm absolutely comfortable with not suspending the parade this weekend. This is a very fluid situation. Things change from moment to moment, and at which time there becomes a situation to where we're receiving a higher risk of our people, then I will make that call. But right now, there is no need to panic. There's just a real need to continue to collaborate, listen, and learn more about the impacts on our people, on our city, on the region. We do know that the individual is a resident of Jefferson Parish, however, is in Orleans Parish right now. I have been in communication with Madam President Cynthia Lee Shane as it relates to this matter as well. We're going to work collaboratively and absolutely fold her into our conversations, our discussions as they move forward. We do know that there is a state convening of healthcare leaders today at 5 p.m. Our director, and she'll speak to you very soon, is prepared to join in that in that meeting. So with that, I'm going to turn it over to Dr. Jennifer Vegno, as you know, is our director of the city's health department. So Dr. Vegno.
Thank you, Mayor. Thank you all for being here. As you know, this has been a fluid situation, and we have been preparing for this. As Mayor Cantrell said earlier today, the Louisiana Department of Health received confirmation of the first presumptive positive case of COVID-19, the novel coronavirus. The New Orleans Health Department was immediately notified of these results, as was the mayor by the governor, and so we've been planning and discussing ever since. To reiterate, it is a Jefferson Parish resident who is hospitalized in Orleans Parish. Presumptive positive is a term that state labs are using when they have a positive case. It is completely within the protocol to then have that case sent to CDC. So this is in line with what other states are doing. The Louisiana Department of Health, again, the lead agency, has already begun investigating who the individual was in close contact with. This is something that we call contact tracing. The New Orleans Health Department will assist them however they need assistance. Again, there is only one known case of COVID-19 in the state at this time. We expect to see additional testing ramping up this week. As you know, tests are being made available through commercial labs, and we do expect those to be online and available to local providers later in the week. I want to be clear, this is not a time to panic. This is something that we have worked for. This is something that we have planned for. We have constant communication with our state health department. We have communicated with everyone throughout the city. We are reaching out to every segment of the community, and we feel prepared as we can be. This is a fluid situation, and we do expect things to change, and we are ready for that and plan for that as well. I'm going to continue to encourage everybody to take common sense precautions to protect yourself and your loved ones and prevent the spread of all respiratory illnesses, including COVID-19. Cover your cough, wash your hands. Soap and water is preferred. Plain old soap, plain old water. Hand sanitizer if you cannot get to a place that there's soap and water, but all of those wash your hands for longer and more often than you're used to. If you have surfaces where you work or at home, disinfect them frequently with cleaner. If we're asking everyone, if you are sick, if you are elderly, if you have serious medical conditions, stay home. There'll be a parade next year. We want you to protect yourself. So don't put yourself at risk. As Mayor Cantrell said, the risk to the public remains low, but we do want those who might need extra help to take extra precautions. Thank you.
Thank you so much. And I'm going to ask Colin Arnold, our Director of Homeland Security, to also give an update from his perspective as well.
Thank you, Mayor. Good afternoon. New Orleans Office of Homeland Security and Emergency Preparedness is monitoring this situation very closely, along with our partners in public safety and public health. We're providing regular situational reports to all of our relevant stakeholders, including our leadership. We're also working with our administration to ensure public safety agencies and all departments are taking necessary precautions to limit the spread of germs. We've been preparing for the possibility of local cases for months now, and unfortunately that day has come. I think as early as last week when we had our tabletop exercise, we talked about it really was a matter of if, it was a matter of when, and that when is now. I want to assure you that we have a great team of local, regional, state, and federal partners who are coordinating this response. And as I mentioned just last week, we had a large tabletop exercise with over 95 participants at all those levels of government. And we tested response plans in response to an outbreak in New Orleans. Those plans are being put into action, further refined as we speak, especially with regards to public safety, hospitals, transportation, and schools. This is not a time to panic. The Department of Health is investigating who this individual came into contact with most recently, and at this point there are no indications that would lead us to significantly change business as usual. So scheduled special events, as the mayor and Doc pointed out, will go on as planned at this point. Should that change, we will tell you. We're in constant contact with special event organizers, even for events down the road, and that includes up to and including today. The conversations have been very forthcoming and very well received by the event planners and of course by us. And we want to make sure that we're doing everything we can to do what's best for the public. So for the public, it's important that as this situation evolves, that you get information from reliable sources, including the Centers for Disease Control, the Louisiana Department of Health, and here in New Orleans at NOLA Ready. You can find us at ready.nola.gov. You can find us on social media at NOLA Ready, and you can get real-time alerts to your phone by texting COVID-NOLA, that's one word, COVID-NOLA, to 888-777. That's COVID-NOLA to 888-777. If you're a visitor to our city, you can receive these same alerts temporarily for a week-long period by texting Tour Safe NOLA, one word, Tour Safe NOLA, to that same number, 888-777. We want to use our public information resources to ensure that you are prepared and not panicked. And we want you to have the facts, not fear. Thank you.
Thank you so much, and we have a tremendous track record of positively being able to communicate with the public. That includes our visitors, and we want to keep that going. So to Colin's point, that text 888 or to 888-777, you do COVID NOLA, or that's if you're a resident, and then let's give it to them again if they're tourists.
Tour Safe NOLA, one word, Tour Safe NOLA to 888-777.
Thank you so much. And so I wanted to ask Councilmember Nguyen if she would want to say a few words, and of course share in Vietnamese, which is a priority for us all.
Well, thank you, Madam Mayor. First of all, I just want to thank everybody for being here. Thank your administration in your efforts of educating our public in reference to the coronavirus and making sure that everybody gets the same alert. So with that, xin quý vị lên nhắc là hôm nay bà thị trưởng LaToya Cantrell muốn nhắc quý vị là lên tiếp tục rửa tay nếu quý vị mà bị bệnh. Và thị trưởng muốn nhắc quý vị là đừng có lên đi đâu hết. Ở nhà nếu quý vị mà có ho á, thì quý vị che cái ho của quý vị đi. Và thành phố cũng có một cái cách là quý vị có thể biết tin tức về cái coronavirus, là nếu quý vị bấm số điện thoại 888 777, quý vị đánh vô Corona Việt là CORIDNOLA, quý vị sẽ được tin tức về những cái gì về coronavirus, thành phố nó sẽ bỏ ra. Cảm ơn quý vị.
Thank you so much. And before we wrap up, Colonel, is there anything you wanted to add? Anything I need to restate from me, something I didn't do right?
Thank you, Mayor. I just want to reiterate what you've already heard. This administration has been working on this topic and on this subject for over 3 months. We've spent an enormous amount of time planning, coordinating, not only at the regional level, but the state, and more importantly, the federal level, and the resources required to do our job. This subject and this challenge is not a one-day challenge. The challenge is to ensure that we make the right decisions at the beginning in a sustainable mode so we can carry this out until we get to the satisfactory end. So that's been our challenge from day one, using the resources that we have. How do we do this in the best possible manner to provide the safety and security for our citizens, our visitors, but in this job, one of the most important people and group of people we look out for are our employees who have to carry out the missions, our first responders. So we have to know what the mission is and take care of our people to be able to accomplish it. And we spend a lot of time doing this, and I have every bit of confidence in the organizations who are tasked with the very difficult challenges ahead that we'll be talking in the future, because this is not the end, this is the beginning.
Thank you, Colonel. Thank you for that. And so we'll take some questions if you have any.
Madam Mayor, WDSU.
Okay, do we know what hospital, the person who may have gone?
That information remains private. Thank you.
Fox 8.
Age or gender of the person being treated?
Well, we're keeping that private as well.
The Advocate.
What precautions is the hospital taking to ensure that its other patients and its employees, they are protected? And also, can you speak to maybe whether there's contact tracing of anyone who the employees come into contact with?
Right, so the hospital is proceeding as if it was positive, determined by CDC, and that does trigger tracing. And Dr. Vegno, you can speak closely to what that looks like, also dealing with any of the care providers that have come into contact with the individual, if they move from floor to floor, things like that is a part of their process. But Doc, you want to speak a little more clear on that?
The Louisiana Department of Health epidemiology team is very skilled at contact tracing. This is not the first disease. They do it all the time under the radar for a number of diseases. So they are, they have their own protocols of how to contact, and they are very, very detailed in terms of trying to get every person, whether it was in the hospital facility or even outside, trying to track down as many people as they can and assess their individual risk. And like I said, we are here to assist them with that.
And if there is an individual or a case where the virus would spread, it would be the state that would have the ability to shut down that hospital and to ask people who have been coming into contact with people who potentially could be affected to go into quarantine.
So the state, yes, the state works hand in hand with the CDC, current guidelines, and then they would make that determination.
WWL.
There are medical professionals who have patients they would like to test for the coronavirus, but say they can't because they don't meet all of the guidelines, like these people didn't travel from overseas. Does this case change that?
This case doesn't necessarily change that. We are encouraging all healthcare professionals to call the 24/7 Louisiana Department of Health Epidemiology hotline. That is just for providers, and they can walk them through. The state may be able to do more testing, but more realistically, and this is what's happening all over the country, now that commercial labs have the ability to test, that will open up the ability of doctors' offices and hospitals to be able to send their tests to those commercial labs. The turnaround time on those is several days. It's not a few hours, but it's my understanding that the major lab testing companies now do have that ability. And so each doctor's office or hospital, and many of them have already been planning for this, will be able to do the testing with them.
WWL.
Yeah.
That's a good thing.
It's no secret emergency rooms operate at saturated levels already. With the first coronavirus now pinging, there might be a surge towards these emergency rooms. Are you guys setting up any additional screening procedures or any place for people to go to be screened? And then second, I want to give you an opportunity to go over some of the steps people can take to make sure that they don't infect their cohorts and how important self-isolation is.
Sure. So again, we are asking everyone to, if they feel sick, to contact their healthcare provider. Your primary care physician is always the first person you should be calling. We ask that they call first rather than going to the doctor's office. If they don't have a healthcare provider or they have trouble getting in touch, there is a state Department of Health hotline for individuals, for the public, that can also give advice. We do ask that folks if you do not feel significantly sick, please don't go to an emergency department. If you are very ill, or your loved one appears to be very ill and might need to be hospitalized, please call 911 as you would for any time you felt ill. But we do want to minimize the burden that this might have on emergency departments.
Is that state health office number, should that be the first step?
If you don't have a primary care provider and you want to talk about your symptoms with someone, then the public hotline would be a good first step.
And then just importance of self-isolation and not passing it on to your cohorts.
Right, again, if you feel sick for any reason, please stay home. Again, we have been talking for weeks, we have been asking businesses to really take a look at their leave policies and to do everything that's necessary in order to keep their employees safe and healthy, to not affect others at their business, and to make sure that employees know that they will be supported if they stay home. This is a national conversation. It is a great conversation to have around paid sick leave.
Absolutely.
WWNL.
Send one of my employees home early.
What is the standard or threshold for restricting or canceling mass public gatherings?
Well, it's going to depend on, like we said, this is very fluid. And we don't want to excite fear in the public. And that's very important. And once you start down that road, it's very difficult to pull it back. And as the Colonel indicated, when you're talking about even resources, we do not want to hit the panic button and lose sight of the resources and the dollars that are needed to address whatever those issues are. And so with it being fluid, we want to make sure as we move through that we're able to access resources. And so right now, we're doing the right thing. When things change, based on the amount of cases, positive cases, that sort of thing, then we will make decisions at that time. But right now, based on the information and the facts that I have as mayor, and it's been guided by our public safety leaders, both locally, state, and federal, that we are low in terms of a risk. And so we will have things move forward in terms of special events as they have been planned to date. And when that changes, you all will be the first to know. But it's very fluid. It really is.
WVSU followed by Fox 8.
Do we have any information about how this person may have gotten it?
No, we do not.
Okay.
What we know is that the individual went to an emergency room and had been there for a while and was tested because of, pneumonia, I believe. And it was kind of getting more severe. But at that stage, the healthcare workers decided to move forward with testing. That did happen. And early this morning, it was determined that it was a presumptive positive. And that's what triggered then the next step, which is getting the CDC to fully test and determine officially whether or not that case is positive. That's the one that we know of in the state of Louisiana at this time. And so the hospital is moving forward as if it is official, so that they're taking all of the necessary steps and throughout their process to mitigate any transfer of the virus.
Fox 8.
Has the hospital in question been put on lockdown?
No hospital is on lockdown in the city of New Orleans.
Last question, WGNO.
Do we happen to know of any places that the person may have gone to previously before going to the hospital?
We do not know that now. That's a part of that tracing process that takes place. And so those steps are happening right now. You have something you were handed you need to share? Oh, okay. Don't be alarmed. This is that hotline, and Steve kind of alluded to the hotline
For the public.
for the public that we want to share. But as it relates to the tracing the social behavior or where the individual was employed, that sort of thing, that's still very fluid. And that's a part of, again, the contact tracing process that's happening right now. So the Louisiana Department of Health, the hotline for the public is 855-523-2652. That's 855-523-2652. And so that's great information to have. And this really does come into play, especially when our people do not have access to a primary health physician, that they can get answers to the questions that they seek by calling that hotline. And we're encouraging everyone to do so as a first step.
When did this person go to the emergency room? Was this morning, yesterday, day before?
No, I really can't even confirm that. Exactly when the individual showed up. That's actually a part of the contact tracing that's happening right now. So hopefully we'll have more details as the process unfolds.
Fox 8.
Does the city plan to suspend any non-essential travel? And if not, at what point would that be triggered?
Sure. Well, right now we haven't suspended any travel. I'm expected to go testify in D.C. on Thursday. And we have even a council member that's at a National League of Cities convening right now in D.C. So at this time, we have not suspended any travel. That can be forthcoming, but it will be a part of the discussions that we're having today and that we'll continue to have as the days progress.
WGNO.
In regards to travel, any updates in regards to the cruise ship industry here, the airport, or anything, any updates on any of that stuff?
Well, the basic updates, and I'll have Colin kind of lean in. We've been on having meetings from early this morning, all from, last week, and we had, of course, our cruise ship industry a part of our tabletop as well. But Colin, you want to share any?
Sure. The port actually reached out today. They do have a press release out right now, and I'm sure you can follow up with them on the details, but the highline details are they're operating as normal as far as cruise ship arrival and departure from New Orleans. The cruise ship industry itself is taking on some responsibility of actually doing some temperature testing and some things of passengers before they board vessels. And so we were informed about that on Friday, and that was verified today in the press release and the indications that I got from the port, from their cruise ship division. So right now, they are operating as normal, but the cruise ship industry itself is taking some further steps towards the safety of their passengers and the public.
All right, so that's all we have. If there are no further questions, we'll be back. We'll keep you, informed as we learn more, and we just appreciate you. Thank you.
Thank you.